Hello. In this video I'm going to be documenting the double jaw plus revision genioplasty surgery that I had at Richardson's Dental and Craniofacial Hospital September 30th, 2021 in Nagarkoil, India. I'm going to give an honest review of Sunil Richardson, and I'm going to tell you what he did do and what he did not do during the surgery. And from the facts that I'm going to lay out in this video, you can make up your own decision on whether Sunil Richardson is actually a good surgeon. So why did I have double jaw surgery? I had double jaw surgery, number one, to correct my retruded appearance. Both my upper and my lower jaw were retruded about 10 millimeters. I also was diagnosed with severe obstructive sleep apnea. Both of those reasons were the main reasons why I had the double jaw surgery. I had a class 2, or basically a class 1 malocclusion, which was a deep bite based on the first frame, with a class 2 tendency. I had about a 3 millimeter overjet with a 3 millimeter overbite. My bite was actually very good before the double jaw surgery. And as you probably know, since you're watching this video, one of the main reasons why people get double jaw surgery, or its original intent, was to correct a bite that cannot be corrected through orthodontics alone. So I had double jaw surgery, number one, to fix my retruded appearance, and number two, to cure my sleep apnea. So why did I choose Sunil Richardson? I chose Sunil Richardson for a couple reasons. The first reason was the years of experience. He has about 20 years of experience and the number of jaw surgeries that he's performed. I followed him on YouTube for about a year and a half before the surgery. I studied his style, how he would mark and cut the bone for the genioplasty, and it instilled confidence that he could successfully carry out a double jaw surgery. The second reason I hired Sunil Richardson, I consulted with a lot of maxillofacial surgeons in the United States, and a lot of the plans that they put forward were not aggressive enough for me. I wanted the most aggressive plan I could get. And out of the surgeons that I consulted with, Dr. Anapov's plan in Sacramento, California was the most aggressive. In that plan, my B point would have came forward 15.5 millimeters. My Pagonian would have came forward 16 millimeters, and my lower Mendelian incisor would have came forward 12.5 millimeters. Unfortunately, Dr. Anapov never followed up with me. He never contacted my insurance company. He never contacted my orthodontist. And he never contacted me, despite me coming out there with all my credit cards, wanting and willing to pay for the surgery. Dr. Anapov was my top pick for the surgery. Unfortunately, he didn't want me as a patient. One of the reasons, he said he likes operating on virgin faces. I had a previous genioplasty from Dr. Epley, and it was asymmetrical. And the genioplasty actually had to be taken back a little, 3 or 4 millimeters after the counterclockwise rotation of the plan of the double jaw surgery. So those were the two reasons. Number one, I thought Dr. Sunil Richardson was a good surgeon, years of experience, number of surgeries. And number two, I wanted an aggressive plan with a lot of downgrafting, actually, because I consulted with a lot of surgeons in the U.S., and a lot of them didn't like downgrafting. In Dr. Anapov's plan, it included a 12 12 millimeter downgraft at the posterior nasal spine, actually. Um, and a lot of surgeons wouldn't do that because of safety and liability purposes. So I just wanted a surgeon to basically do what I want, essentially. So what was the surgical plan? Well, viewing the left picture, you can see both my mandible and my maxilla are severely protruded. But you can also see that my menton is actually strong, excessively strong for the mandible. So in the left picture, I had a previous genioplasty by Dr. Epley. I had a chin implant actually for 17 years, and in July of 2020, he removed the Plerex chin implant, and he moved the horizontal position of the chin to about the same as it was before, which was about 5 millimeters, and I gained about 8 millimeters vertical. But as you rotate, you can see my occlusal plane angle is kind of steep. It's a little deceptive because my head is angled down, but my occlusal plane angle is about 12 to 15 degrees. So as you rotate counterclockwise, you don't want the chin to be in front of the lower lip. So that's why part of the plan was to take back the chin 4.5 minus 4.2, actually minus 4.9 millimeters, and down 4.2. That was a genioplasty. The maxilla, the anterior nasal spine, was supposed to come forward 6.8, and then down 2, but actually he did, as you'll see in the video, he did 3 or 4, which that was fine. And the posterior nasal spine was supposed to come down 12.5. My upper midline incisor is supposed to come forward 13 and down 3, and my upper molar was supposed to come forward 10.6 and down 7.9. The mandible movements are just to get the occlusion back, but I'll say them anyway. My B point was supposed to come forward 15.5, down 5.3, Pagonian 15.9, down 7.9, upper midline, lower midline incisor 12.3, down 3.3. So those were the it was supposed to be a big counterclockwise rotation of the jaw, and downward movement as well, and anterior or posterior reduction of the genioplasty and additional downgrafting of the genioplasty. This is what I would call probably a forward-grown face, or if you want to call it the Chad look. I think this represents the best possible outcome that I could ask for, and that's what my goal was for the surgery. So I want to get into the results of my double jaw plus revision genioplasty by Sunil RIchardson. To say the least, the results were disappointing. Little, if any, advancement occurred to either my maxilla or my mandible. He did downgraft me, though. He did downgraft the maxilla, which was part of the plan, but not a lot of counterclockwise rotation occurred. As far as the chin goes, he did reduce. He brought the chin back 3 or 4 millimeters, which is what I wanted, and down maybe 3, 4, 5 millimeters. He did not resuspend the mentalis muscle correctly. I have lip ptosis now. I'm showing a lot of lower teeth. I have to get my mentalis muscle resuspended. And I feel I was scammed. So I'm going to go slide by slide and show you the results. So now I'm going to go over Larry Wolford's review of Sunil Richardson's surgery. The reason I want to go in depth about this, there's a lot of people out there that give what I think surgeons too much benefit of the doubt. Um, people view surgeons as deities in a sense. They think they're infallible. And I'm going to expose Sunil Richardson. This is more evidence, further proof that he scammed me out of $22,000, okay? Mind you, I saw Larry Wolford around February of 2020. I initially approached him, but his wife, Denise, never filed any prior authorizations with insurance. So, like, I couldn't get the hospital bill covered. And he's also, Larry Wolford is a big TMJ person. I think he overprescribes TMJ to patients that don't have pain. Although a lot of his patients that see them have degenerative joints. I don't think you should go through a total joint replacement just from degenerative joints. I think there should be some pain. So that's part of the reason I went to India. Another reason I went to India, I had the surgery. I had a maxillofacial surgeon in Cleveland. I'm not going to say the name. And he put out a bad result. He put out a result that was not impressive. Very little advancement. So I went to Dr. Anapoff in Sacramento, California. I got an aggressive plan, and I took it to Sunil Richardson, hoping that he would execute that plan. But without further ado, I want to read you this report so it lays to rest any doubts about what Sunil Richardson did or did not do during my surgery. Joseph is a 37-year-old, birth date 3/29/84. I previously evaluated Joseph on January 20th, 2021. I worked out a definitive treatment plan to get him the best possible outcome relative to his issues, including a poor result from a previous double jaw orthodontic surgery. That was actually a genioplasty that I had from Dr. Epley of July of 2020. I think he had a little typo there. I had given him a quote on what the cost would be. Joseph instead elected to travel to India to a craniofacial clinic there and had double jaw orthodontic surgery performed. The results are disappointing to say the least. And that's the truth. Joseph said he had been treated by having the maxilla and mandible advance in a counterclockwise direction and had bone grafting done just in the posterior maxilla that was downgrafted. He did, let me stop there. He did do a counterclockwise rotation, based on the video, but I think it might have relapsed. And he did not do anterior bone grafting. He also had his chin work done, where his chin was moved posterior and lengthened vertically. That's moving the chin back and down. That was part of the plan. The surgery was September 30th, 2021. He's now 3.5 months post-surgery. I took the cephalometric tracing that I did from January of 2021 and compared it to the new post-surgical imaging. It shows that the entire maxilla was downgrafted approximately 5 millimeters and no counterclockwise rotation was performed. I must have relapsed. In fact, the B point of the mandible has been rotated posterior about 4 to 5 millimeters. The maxilla was not advanced at all. The chin was lengthened vertically and moved posterior, so the chin point actually moved posterior about 6 millimeters. He also said my viewpoint, by the way, was supposed to come forward 12 to 15 millimeters. He also said he was told that only posterior maxilla was bone grafted, but not the anterior aspect of the maxilla, which means that he may not have have very good stability of the maxilla. He has 3 bone plates on the right side and 2 anterior bone plates with only 1 screw above and 1 screw below the osteotomy site, and the posterior plate has 2 screws above the osteotomy site and 1 screw below. On the left side, he has 2 bone plates, with the anterior plate having 2 screws above the osteotomy level and only 1 screw below the posterior plate, and the posterior plate only has 1 screw above and 1 screw below the osteotomy site. In the mandible, there is some significant loss of vertical bone in the body area adjacent to the first and second molars. Following this, I'm going to provide imaging to that. In the video, he said he did angle osteoplasty. I never asked for an angle osteoplasty. The roots of the second molars are almost at the inferior border bilaterally. On the right side, he has 2 4-hole bone plates with only 3 screws in each bone plate, and on the left side he has 2 4-hole plates with 4 screws in the upper plate and 4 screws in the lower plate, but 1 screw has fallen out of the bone. He has 2 bone plates in the mandible, and it appears that the mandible has been downgrafted, but difficult to tell. So yeah, I did ask for double plating. It's a good thing I asked for double plating because one of the screws fell out. And if I didn't ask for double plating, I would have a very unstable result. It has been moved posteriorly. He has 2 screws in the infraorbital area where he had a previous cheek implant placed, but I believe that was done prior to the most recent surgery. Radiographs show he had a severe TMJ arthritis with articular disc dislocated but advanced bone destruction. He has a malocclusion where his bite appears to be opening anteriorly and including primarily on the mandibular left molars, and his right teeth currently do not touch. That's the truth. He screwed up my bite. He has a pontic to replace the maxillary left central incisor that is actually extruded, coming about 2 millimeters below the crown on the right maxillary central incisor. Radiographs also show he has hyperplastic turbinates. His oropharyngeal airway is decreased, and he continues to have severe sleep apnea. He has significant lower lip ptosis as a result of the most recent surgery, and also probably is a byproduct of his initial chin procedure. Apparently, the mentalis muscle is not resuspended at this most recent surgery. Basic diagnosis for Joseph would include the following: bilateral TMJ severe arthritis, maxillary anterior posterior vertical hypoplasia, mandibular anterior posterior and posterior hypoplasia, significant loss of bone at the inferior border of the mandible bilaterally at the first and second molar area, lack of bone grafting in the anterior maxilla, hypertrophied nasal terminates creating nasal airway obstruction, decreased oropharyngeal airway, including only on the mandibular left posterior teeth, in slight class 2 N-on-N occlusion relationship. Recommended treatment plan was followed. Review CT scan that was taken 3 months post-surgery. Joseph descentomy, CT scan and jaws and jaw joints, TMJ concept protocol. Pre-surgical orthodontics.
Maintain current alignment of both maxillary and mandibular arches. Do not use any inner arch mechanics. Do not attempt to improve the occlusal relationship. Surgery. Bilateral TMJ construction and mandibular advancement in a counterclockwise direction, advancing the mandible about 10 to 12 millimeters. Bilateral TMJ fat grafts harvested from the abdomen. Bilateral coronoidectomies. Maxillary osteotomies to advance forward approximately 8 millimeters with bone plate stabilizing and bone grafting. Bilateral partial inferior turbinectomies. Resuspension of the mentalis muscle to correct the lower lip ptosis. Remove bone plates as necessary from the maxilla and mandible. Post-surgical orthodontics to refine and retain occlusion. This should give Joseph the best possible outcome. I explained to him the original surgical plan, the results of his most recent surgery, and the plan necessary to correct his situation from his current status. So I followed up with Dr. Wolford actually, and since I don't have out-of-network benefits, I don't think I can. I don't think I can have a surgery with Dr. Wolford. To pay out of pocket, that would be $125,000. That's what Denise said. That's ridiculous. Anyway, how does a 2 or 3 day stay at the hospital need that? And again, they didn't file any prior authorization for my insurance. I don't have out-of-network benefits with these HMOs. So there's one last doctor within my HMO network that I'm consulting with right now. I'm not going to say the name. But if that doesn't work, if I can't get him to do the surgery, I don't know what I'm going to do, because I'm not going to risk $40,000 or $50,000 to get scammed again. I already got scammed once. I'm not trying to get scammed again. But I just hope this exposes Sunil Richardson for the fraud he is. No advancement of the mandible or maxilla, occlusion, got significantly worse, did not resuspend the mentalis muscle, lower lip ptosis, decrease oral pharyngeal airway. Okay? He's not a good surgeon. Okay, I just want to put that to rest. Okay, in this slide, I'm showing you the significant loss of bone underneath the right first and second molars. I don't know why or what caused the lack of bone to go missing, but I'm missing a lot of bone, and I don't even know if I can do another advancement because of bone contact. I don't even know if I can do another BSSO advancement. I might have to do it by a total joint prosthesis. But if you zoom in on that image, you'll see underneath the plate it's all dark. There should be white bone underneath the plate, so it looks like there's nothing underneath the plate. But you have to zoom in on the image really closely to see that it looks like I'm missing a lot of bone. And in his video, he said he performed an angle osteoplasty. I never requested an angle osteoplasty once. Those words never even left my mouth during the pre-surgery consultation. So I'm not sure if the reason I'm missing bone is because he performed an angle osteoplasty on me. But I just wanted to show you that I'm missing a lot of bone on my first and second molar. So I wanted to talk about my discharge summary, since Sunil Richardson likes to say that I'm not a real patient on his Google review. In the discharge summary, you will see that I discharged myself after 2 days in the hospital against their recommendation of 5 to 7 days. The reason I discharged myself from the hospital after 2 days is because I just didn't feel safe in the hospital, to be honest with you. They sprang new additional charges on me after me being charged $22,000, which for India is astronomical, actually. And to go into this, initially when I approached Sunil Richardson, he said the price was $10,000 for double jaw surgery and $3,000 for genioplasty. That was the initial quote, and I sent him two mediocre plans where both jaws were coming forward about 10 millimeters. I did approach him with a more aggressive plan where it would require, the 12 millimeter downgraft posterior nasal spine. And he said, before I came to India, he said it would be a little more for that, like maybe 5 or 6,000 more. But they can't give exact costing until I get to India, okay? But I was really excited about the plan, so I rolled with that. And then when I get to India, the price is $22,000, okay? But I went with the $22,000 because I was really excited about the plan. It was an aggressive plan. Before the surgery, I did ask him, I asked him, could I get double plating? Because that's a standard thing that you're supposed to do when you're doing mandibular advancement is double plating. After I paid the $22,000, and he said it would be an additional $600 or $800 to put two extra plates in, which I guess I agreed with that. But that was after I paid the $22,000 actually. So that was the first thing. I was in the hospital and they wanted me to pay another $1,000 for two extra plates, which is after I'm paying $22,000, which, most people, I've seen other people quoted, other people getting double jaw surgery in India, they're paying like 2.5 or 3 lakhs. But that's a separate issue. And another reason I discharged myself after the 2 days, they were aggressively trying to charge me for juice, like pineapple juice, while I'm in the ICU. So after me paying $22,000, they're trying to sell me coconut juice while I'm in a compromised position in the ICU. Every 2 seconds, they're annoying me and pestering me. Do you want coconut juice? Do you want coconut juice? And they're trying to sell me coconut juice for like 80 rupees every 2 seconds after I paid $22,000 for double jaw surgery, which is insane. So that's why I discharged myself. And after me looking at myself after day 1 and 2, in fact, even after me waking up, it was obvious that my jaws were not advanced. From the moment I woke up from anesthesia, I know I was scammed. I was still recessed. That's why I didn't pay the extra $1,000, because I was scammed from the get-go. The $22,000, no advancement of both jaws, and they're trying to add insult to injury. They're trying to heavily sell me coconut juice while I'm in the ICU. That's why I discharged myself against medical advice after 2 years in the ICU. And I actually felt pretty good, actually, after 2 days. There was no need for me to stay 5 to 7 days in the hospital, so they can make additional money off of me and me to incur additional unexpected charges. So I just wanted to go over that about the discharge summary. So I hope by you watching my video, I've shed some light on my surgery that Sunil Richardson performed, and hopefully I've convinced you that Sunil Richardson is not a good surgeon. Okay, I know he puts out a lot of good results on YouTube. Those are the good results. Okay, there's a lot of bad results that he puts out, and I'm not the only person that has issued online complaints about this. Hopefully that you found my video informative, and if you can, if you know anyone that is considering getting orthodontic surgery by Sunil Richardson, tell them to go somewhere else because he is bad news.